All right, good afternoon, everyone. We're going to go ahead and get started. I'm Dr. Adrienne Trogden, so I want to go through a couple of housekeeping things and then we'll dive in. You are going to be muted and your videos are going to be turned off throughout the entire presentation. We are recording and this presentation will be posted after for others to be able to take a look at and get the information. So because of that, we need to keep all of your faces off the screen so you're not part of the recording, and your microphone's muted. So I'll be keeping everybody muted throughout. But if you have questions or comments you want to make, please feel free to use the chat function. And I will be kind of paying attention to that throughout our presentation and try to answer all your questions as we go, or if not, we'll get to it at the end. So with that, we're going to go ahead and dive in. So like I said, I'm Dr. Adrienne Trogden. I do lots of these types of webinars, and currently we're in a kind of series for the rest of the year related to gender, sexuality, and addiction treatment. So today we're focused primarily on addiction treatment as it relates to transgender, intersex, and non-binary clients that you might be serving. So we're going to talk today about lots of things, and hopefully we'll get through it all in an hour, which is a very short period of time, but we will do our best. And so let's dive in. So we've got some objectives for today. We're going to be talking about a couple of things primarily. One is kind of getting a definition related to transgender, intersex, and non-binary. So we're going to be talking about the characteristics of those different identities. Secondly, we're going to talk about culturally sensitive treatment strategies for these individuals and what we need to kind of pay attention to and be aware of as we're working with individuals with these identities. And third is really to gain personal awareness as a therapist of biases, any stereotyping or kind of devaluing that we want to pay attention to and avoid, hopefully, in our work with these clients with these identities. So let's get into some definitions. So first, I want to globally talk about how gender is evolving, which is a bit of a misnomer, because actually gender identities that are non-binary in nature have been around for thousands of years. So this is not a new concept, but it's kind of seen a revitalization of sorts in the past several years. So let's talk through those. So when we think about gender as a concept, there's a couple of components that we need to look at. So you can see in the middle of your screen a red bubble that says gender, and then you see these little yellow bubbles off the side. And so these are the components of gender. So we have biology as a component, which is our physical makeup, our genitalia, our chromosomes, our hormones. So that's biological component is a component of gender. Then we have a more psychological component of identity, which is identity is our psychological sense of self. So how do we feel about ourselves on the inside? And then expression is a component, which is how we demonstrate or show the world our gender on the outside. So how do we express our gender to other people? And then you'll see the bubble in the bottom right corner that says sexual orientation with an X through it. And the reason there's an X through it is because while sexual orientation and gender influence each other and have some level of overlap, they're really separate concepts. Sexual orientation is more about who we find attractive, who we are sexually attracted to, what types of people, and those characteristics of those people. But that doesn't define our gender. So the way that we identify from a gender perspective is a separate concept from who we're attracted to sexually. So what we're going to be talking about today is just the gender components. And we're going to, while we might mention a few elements of sexual orientation, we're really focused on gender today. So try to make that adjustment in your mind that we're really not talking about sexual orientation. It's about gender identities. Okay, so let's break each one of these things down. Let's look at biology. So traditionally speaking, we've had a binary concept of gender with the male and the female, and that those are binary because there's two of them and kind of two categories of people, of gender identities. So historically speaking, if you look on the left side of your screen, it should be, is the blue bubble that says male, technically has, or historically has been thought of as mostly heavy on testosterone in terms of hormones, genitalia that would be consistent with what we traditionally think of as a male, and XY chromosome. And then on your other side of the screen in the kind of pinkish purplish bubble is female. Chromosomes of XX or XY tend to be heavier on the estrogen and have genitalia that's traditionally thought of as female. But then we kind of have some elements that are in between or separate from male and female. So if you look at the green bubbles in the middle, we have intersex, which in quotes is the term hermaphrodite, which is an old term that was used to describe people that have a combination of genitalia or gonads, chromosomes or hormones that could be both kind of traditionally male and female in that regard. But actually hermaphrodite is an incredibly non-PC and considered a slur at this point and inappropriate to use. So I just use that to identify that that's what we used to call it. And now the appropriate term would be intersex. And we're going to get into this in more depth going forward, but just to give you kind of a broad overview, that intersex includes a combination of what we traditionally would think of as male or female, could be chromosomes, hormones, or the genitalia pieces. So then in that second bubble is transitioning. So we have people that would be considered transgendered, and they are making a transition or are living their life in a different gender than the one that they were identified as having at birth. And we'll talk about that a little bit more specifically. So someone can transition from one gender to another. And there's all kinds of elements that we're going to talk about that are components of a transition. But that would be considered transgender. And then the bottom is intersex with a biological sex assigned during infancy. So basically think about when a baby is born, the doctor holds up the baby and says, it's a girl, it's a boy. Because of their external genitalia that can be seen. That's often the way that a baby is identified gender-wise when they're born. But if a baby is born with genitalia from what is traditionally thought of as male and female, if there's a combination of those, there's oftentimes medical procedures that are done or have been done to make the child's genitalia appear more quote unquote normal. And I put that in quotes because it's normal insofar as what has traditionally been identified as male or female genitalia. So they want to put the child in one category or the other of that binary structure of male or female. And so some medical procedures for kids that are intersex have been done to make their genitalia appear more normal or more male looking or more female looking in those regards. And we'll get into that a lot more later. So all of these things are about the biological components of gender. So let's take a look at the psychological components of gender. So psychological components are related to our gender identity, how we identify ourselves. So that's where these terms come into play of the binary ones that we've just been talking about, male and female. And then we have these other terms that have gotten much more attention of late, of non-binary, which means that someone doesn't feel that they fit into those binary structures of male or female. Transgender, which means that there's some kind of transition from the sex assigned at birth of male or female to a different gender. Or intersex, which we just talked about as having some components biologically of the binary structures of male and female. So, but the identity is really this psychological sense of self. So when looking internally within ourselves, how do we identify? Do I identify more non-binary, where I don't feel like I'm really in the category of female or male, intersex, or transgender? So we're going to break those apart a little bit more shortly. So then the other component, the last component of gender, is expression. So this is how we communicate our gender to the outside world. So I put a bunch of pictures on here of just celebrities and kind of people that have different expressions around their gender. So you can see kind of the David Bowie on the left side of your screen, who kind of plays with expressions that are more masculine and feminine as well. Then you see RuPaul at the bottom, who dresses in drag at times, and that can be an expression of the more feminine nature. And then you see Hugh Jackman in the middle, very masculine, manly type of expression. Then you see to the top right, the two people that are dressed in more gender neutral type clothing that kind of have elements of both masculine and feminine and are just kind of gender neutral in expression. And then at the bottom as well, the Time magazine cover is more of a gender neutral type of expression, or more gender fluid type of expression, where it has elements of the feminine and masculine sort of ambiguous there. And then we have kind of the quintessential feminine of Marilyn Monroe down there, a very feminine expression of gender. So all of these components of biology, identity, and expression combined are what make up our gender. And so all of these pieces are important to consider when you're working with clients that maybe they might look or present as more masculine, more feminine, more androgynous, or kind of gender neutral, but that may not be indicative of their identity or their sense of self, of how they identify their gender. And it also may not be indicative of the biology or their chromosomes, hormones, genitalia makeup of biology. So it's important to not judge a book by its cover, in essence. So looking at somebody, we can't objectively know how they identify their gender just by looking at somebody. Whereas historically, I think that was more the case, where the presentation, the way that they expressed themselves, was indicative more of their gender identity and their biology. And now that's just not the case anymore. So let's break these out a little bit further and look at each of the identities we're talking about today. So first, we're going to break out transgender. So like I said, transgender before is a gender identity that's different from the one they were assigned at birth. So it's more of an umbrella term that is inclusive of people that might be transitioning from male to female, or female to male, or, you know, kind of any combination of those. So it's more of this umbrella term and kind of a category. And if we break it down further, a transgender woman is someone who lives as a woman today and typically uses the she and her pronouns. So, you know, that can look a lot of different ways, but the living as a woman is typically what's considered to be a transgender woman. And then a transgender man is someone who lives as a man today and typically uses he and him pronouns. Now, this is not an exhaustive list by any means of the terminology used, but I just want to give you kind of a frame of reference for, you know, someone who is transgender. They might have been assigned as a transgender woman, they might have been assigned the sex of male as a newborn. And then, you know, now at this point in time, living as a woman, they would be considered a woman, transgender woman. So what is it about this gender transition piece that's important to pay attention to or to be just aware of as we're working with clients? So a gender transition means that they're transitioning from one gender to another. And the possible steps include, and again, this is not an exhaustive list, but just to give us a frame of reference, that they could be changing their clothing, where they might have dressed more masculine at one point in time, more feminine, or more gender neutral, and there's some change in their clothing or their expression. There may be changes in appearance, wearing makeup, not wearing makeup, cutting hair, wearing different types of jewelry, those kinds of things in their appearance that signifies that there's a transition happening. They might change their name. So maybe if they were assigned at birth male in terms of gender and their name was Joe, and now they're a transgender woman, they may change their name to Sarah or something like that. So a name change. And they can also change their pronouns, like shifting to she, he, or they, which is more of a gender neutral term or pronoun rather. And then also changes around identification documents like driver's license or passport. They might go through a process to get their gender changed, their name changed on those documents to identify that there's this transition that has occurred. And they would now like to be identified as whatever gender, whatever name. And so they'll make those changes to those identification documents. Now they may go through some physical kind of procedures. They may have hormone therapy where they're prescribed hormones to activate their body to go through changes to transition into another gender. Or they may have other medical procedures that change the look of their body, their genitalia, or the way that it functions, so that to change those physical characteristics to make their body match the gender that they identify with. Now, those are all possibilities, but not everybody who's transgender goes through all of these changes. So someone can still identify as transgender even if they don't go through medical procedures or take hormones, things like that. They may simply change their clothing and their appearance, and that's their transition. They may change their name, pronouns, things like that. So it's important to understand when you're working with transgendered clients that they may not be going through all of these transitions. It's not, they might go through some and not others. They may do all of these things, but it doesn't mean that they're any less transgender. So that's important to recognize that someone may not go through all of these types of transitions. Now, some of the risks of a person coming out as transgender and identifying as transgender is there's still a social stigma out there. And the social stigma is stronger in some communities as compared to others. So there's a real risk in coming out as transgender and identifying as transgender because of the discrimination and harassment that can happen and the bullying that can occur in communities that is still very rampant today. They also can, depending on what's kind of happens in terms of their identification publicly as transgender, often people will go through a period of depression because while on one hand it's more freeing and more congruent with who they are and who they know themselves to be to identify as transgender, they may not get the reception from others, from family, friends, or social or societal acceptance of who they are. And so there is a real risk there with coming out as transgender and identifying publicly as transgender, whether it be just publicly to family or friends or loved ones, or kind of in the broader community in that regard. But there's also some gains. So there's risk benefits. So the benefits and the gains would be that it's life affirming. It potentially is life saving if they've been, not living congruently to who they are and who they know themselves to be. That can be very depressing and leads can potentially lead to a lot of other mental health related issues too. So it can be, really life affirming, a lot of freedom, able to live as who they know they are. So while there's significant risk, there's also significant gains in making the transition and living in congruently their life with the gender that they know themselves to be. Okay, so let's talk about intersex. So intersex people have reproductive anatomy or genes that don't fit typical definitions of male or female, which is often discovered at birth. So when a child is born, the doctor lifts them up and says, it's a girl, it's a boy, based on external genitalia. But then there's, a process of the medical professionals doing their work and checking the baby out to make sure that they've got, all their fingers and toes, that their heart's working properly, their lungs are working properly. And it's often identified with intersex people. It's identified in this process of infancy as they're being checked out by medical professionals that perhaps their anatomy or genetics don't quite fit with the typical definitions of male or female. So just to put it in context of how often this occurs, that every year an estimated 1 in 2,000 babies are born with a set of characteristics that can't easily be classified as male or female. So some people are born with XY chromosomes but have female genitals and secondary sex characteristics. Others might have XX chromosomes but no uterus, or might have external anatomy that doesn't appear clearly male or clearly female. So there's some deviation in essence of what we traditionally classify male or female as. So it's not as rare as you might think. 1 in 2,000 babies is a lot more common than I think people realize. So sometimes, like I mentioned earlier, there can be surgical procedures that are done that are not necessarily to save the life of the child, but to change those natural variations in their genital appearance or reproductive anatomy, and to make them more clearly fit into those binary structures of male or female. And so this tends to be connected with our kind of societal expectations around gender and sexuality and what normal looks like. So if we operate in the binary structure of what is normally male or normally female, we would think that a normal male has a penis and testes, or a normal female has a vagina and breasts. And if there's a deviation of that, or a deviation of the internal genitalia or reproductive structures, then that would be considered intersex. And these medical procedures that could be done, which there's a list on your screen of intersex surgeries, which is again not exhaustive, there's several more than this, but these are some of the more common ones, is to create or make the reproductive organs that are visible or even internal to look more traditionally male or female, so that a person would fit more into one category or the other. The problem with this in general is that these surgeries often come with long-term consequences. So there can be physical consequences with just altering, genitalia or altering internal organs, but also can have emotional consequences. And that's what we often see through the counseling work that we do, is those emotional consequences. And there's high complication rates. So, and then also can impact their sexual functioning. So there's a lot of risk. And because it's not a life-saving procedure, that when it's done without the individual's informed consent, which obviously a baby cannot give informed consent, the parents would be giving it on their behalf, that the United Nations considers these surgeries as human rights violations. So it's kind of an interesting thing to think about when, parents may be attempting, or caregivers may be attempting to help their child appear more normal, and not recognizing that there's these lifelong potential emotional and physical complications that can arise with doing these types of surgeries with such a young child. And most of these surgeries are done under the age of 2. So the child themselves are not giving informed consent. So there's been a shift in, it's still shifting because there's still these surgeries done today, but we don't have good numbers about how often and how many these types of surgeries are done. So I can't really give you a prevalence rate there, but what there's been a movement to, since it's not necessary for life-saving for these surgeries, that there's this idea that we should wait until the child grows, and if there's any complications with puberty, things like that, those can be addressed. But also that we wait until the child is older, that can kind of get at this gender identity piece, and for the person themselves to make the decision if they need to have surgery, or if as long as it's not causing problems, they can, someone can live a very normal life with a combination of these genitalia pieces or these biological elements. So there's plenty of people out there that are living as intersex and have kind of a combination of gonads or hormones that, that have a normal life. So it's not always necessary to have these surgeries. And so there's been a movement now. That's why that movement has happened, is that it's not necessary for life-saving to have a lot of these surgeries under the age of 2. So why not wait and kind of see how the child develops and allow the child to make a decision once they, kind of get a little bit older, make a decision about if they need these surgeries, or, how comfortable they are with having these surgeries to change their anatomy, in essence. So I put a website down here at the bottom, interactadvocates.org. They have a plethora of information about intersex, non-binary, and some transgender as well. But they are specifically geared towards advocating for these intersex and non-binary persons. And there's a wealth of information there. So I got a lot of information there for this presentation, but also that's a great resource to kind of keep in your back pocket and pay attention to, because they do update it. And there's a lot of good information that you can share with clients that you work with, or parents that have an intersex child that you might be working with, to give them information, give them a resource. So that's a great option to have handy. So these are just a list of other intersex things that could be going on medically with somebody. And just to give you a sense, this is, again, not even remotely an exhaustive list. There's like over 40 different kind of things that can be going on with somebody that would put them in that intersex category. But you can kind of see that there's the medical term, the chromosomes, the external and internal reproduction, and then what kind of happens at puberty. So this just gives you another frame of reference for kind of the more common things that might be seen on the medical side with intersex individuals. Okay, so let's talk about non-binary. So this is an umbrella term as well, similar to transgender, but non-binary in essence means that people don't neatly fit into the categories of the binary structure of man or woman or male or female. So some examples: some people have a gender that blends elements of being a man or a woman, so it's a little bit more inclusive. There's some masculine and feminine elements there. Or it could be someone that identifies as different than male or female, that they don't identify with either one of those categories, and it's something different or a different gender. Some people don't identify with any gender at all. And also some people who are non-binaries, that their gender might change over time. So all of these can be examples of someone who identifies as non-binary. You might hear some other terms. Some people identify as gender fluid. where their gender kind of fluctuates and is fluid with a variety of genders. They might be gender neutral, where I don't really identify one way or another. I'm somewhere kind of in the middle or something kind of neutral. Gender queer, again, a similar term to gender neutral. Could be agender, not identifying as a gender, or bigender, identifying as multiple genders. So these are other terms that you might hear, and they would all be kind of under this umbrella term of non-binary. So it's important when you're working with clients to give them opportunity to self-identify and then explain what their self-identification means to them. So that's kind of a piece of the intake process, which we're going to talk more about in a little bit, of treatment implications for these identities. But it's important to get, when somebody says, I'm non-binary, I always ask, tell me what non-binary means to you. Because it may not, I think I know what non-binary means. I may think, I understand what that means, but I really want them to self-identify, so I make sure I'm on the same page with them. And that's really important when you're kind of in that rapport building phase with clients, and for them to feel welcome and comfortable working with you and in your treatment program. Okay, so what does this mean for people in general with these gender identities? So they're at higher risks for lots of things. One is at the top here is widespread discrimination, violence, and stigma, which can result in gender minority stress, which is kind of a newer concept as we're talking about people that might be in a minority population. There's also a gender minority that can happen, and that can cause a lot of stress just from their identification of self and how they interact with the society at large. And is it socially acceptable to be who they are, and what kinds of discrimination, violence, social stigmas, things like that, that might be in the community that they might be exposed to, and thereby putting increased stress and potentially trauma onto, what they're already experiencing with their, just as we move through life, everybody has different stresses and challenges in life. And this is just an additional layer of that in terms of a gender minority stress. So it's really the relationship between the person or the minority and the dominant values, and then whatever consequences or conflict that come about as a result of being part of this minority group. So we talk about minority stress with lots of other minorities as well, and gender minority is one of those that can experience this type of stress and do experience this type of stress. So what does that mean for them? That means that they're at increased risk of assault, both sexual assault and physical assault. They're at an increased risk of addiction and suicide. So a couple of studies I reference here. One was in 2017. It was a study specifically on transgendered adults. And they compared, basically they took all the claims in Medicare and I think Medicare and VA, if I remember correctly, but don't quote me on that. They compared diagnoses that were put on claim forms for transgender adults. And then they compared those to cisgender adults, which cisgender means that you identify as the gender you were assigned at birth. So if I was assigned female at birth, then, and I identify as a female, that means that I'm cisgender. So I identify as the gender I was born. So they compared the diagnoses of transgender adults to cisgender adults and looked at the prevalence rates for various diagnoses. So you can see the prevalence rates here for alcohol, substance use disorders, drug substance use disorders, and then polysubstances, 2 or more substances. So you can see here that the people that were transgendered had higher rates that were significantly higher rates than the cisgender population for all 3 of these things, for alcohol, drug use, and then polysubstance use disorders. So for alcohol, the transgender population, 2.6%, cisgender only 0.9%. So that's pretty significant. And there were significantly less transgender people that were looked at. Only 15,637 transgender people were looked at, compared to a much higher rate for cisgender of 46,911. So what that tells us is that the transgender population is significantly higher in these prevalence rates for alcohol, drugs, and polysubstance. Looking at the drug substance use disorders, it was at a prevalence rate of 4.3%. And also there's the drugs, you can see cannabis, opioids, and cocaine. And then cisgender was only 1.2%. It's almost like 3 times the rate there. And then polysubstance use disorder, which means that they were diagnosed with 2 or more substances. And the transgender population was 2%, cisgender was 0.5%. So these prevalence rates are significantly higher. This was a study specifically on transgender adults, but it's kind of consistent with intersex and non-binary as well. I just don't have those numbers specifically for you here. So then looking at suicide, there was a massive study done in 2015. It was actually supposed to be done again in 2020. They're trying to do it every 5 years, but because of our global pandemic, that got delayed significantly and hasn't been completed yet at this point. So I don't have current numbers, but you can see that they talked to 27,715 people in 2015. And what they found was that 40% of people that identified as transgender have attempted suicide in their lifetime, which is nearly 9 times the rate of the population in general, in the US anyways. And then 7% had attempted suicide in the past year, or in the past 12 months is how they define that. And that's nearly 12 times the rate in the global US population, or the population at large, I guess I should say. So their suicide rates for the transgender population is significantly higher as well, which is attributed to all these components that we talked about in the gender minority stress a few minutes ago, of the widespread discrimination, violence, and stigma that they've experienced. And again, these are old numbers, they're 2015. So we don't really know, what has shifted quite yet in this large of a study. But what we do know is that they're at higher risk in general for suicide and for substance use. So continuing on with the risk factors, again, this is from the transgender study of assault, that 46% were verbally harassed in the past year because of being transgender. Nearly 1 in 10 respondents were physically attacked in the past year related to their gender. 47% were sexually assaulted at some point in their lifetime, and 1 in 10 were sexually assaulted in the last year. Those are huge numbers. That's almost half. Respondents who had done sex work, which was about 72% of them had done some type of sex work. And those who had experienced homelessness, which was about 65%, and people with disabilities were 61%. All 3 of those were at a higher risk of being sexually assaulted in their lifetime. So again, really big numbers here. 54% experienced some form of intimate partner violence, including acts involving coercive control and physical harm. So again, could be physical assault or this coercive control, and that's half. So looking at these numbers of 27,000, almost 28,000 people, half is big. That's a lot of people. So 24% have experienced severe physical violence by an intimate partner, compared to 18% in the general US population. So again, big risk factors for all of these things: assault, addiction related issues or substance use issues, and suicide. So these are big things to pay attention to when working with this population, that probably a lot of your clients, if they identify as transgender, are going to have experienced several of these things throughout their life. So again, this is from the transgender study in 2015. And it just kind of breaks it down to experiences of people who were out as transgender. So kind of publicly identified as transgender in K through 12 schools, or that they believed that their classmates, teachers, or school staff thought that they were transgender. So they had a perception that others perceived them to be transgender. So this is the prevalence rates for what they experienced that you can take a look at. Again, some pretty high numbers here for our kids that are going through the school system and or just kind of grappling with their gender as they move through developmentally from childhood to teenage years. So again, it's just more evidence that there's a lot going on for these people that identify as transgender, and they've probably experienced a lot of these things. So we have a kind of a trauma element to deal with when we're working with them in our treatment programs. So what does this mean for our addiction treatment programs? So first, we just talked about trauma. Trauma-informed care is huge, and paying attention and screening for, and basically it's a safe assumption that most of your clients that identify with these gender identities are probably have some trauma in their history. And it is probably related in some ways to, and in a lot of ways, particularly for the transgender population, to their identification of gender. So trauma-informed practices and care is really important to be embedded in our addiction treatment. We all know that our clients that come to us for addiction treatment in general are likely to have a trauma history, that is very common. So it's commonplace now, I think, to be more thoughtful and pay attention to trauma, as well as to embed trauma-informed care throughout our treatment programs. But now we have an added layer of the gender-related trauma that could be there for clients that we work with that identify as intersex, non-binary, or transgender. It's really important to be inclusive of the trauma-informed components. So that really should be pretty thoroughly embedded in our treatment programs if we're working with these populations. So now kind of breaking it down a little further about gender affirming care. So we're going to talk about pronouns, but it's really important to use proper names and pronouns. So even if somebody's driver's license or insurance card says a different name, and they've transitioned and they're going by a different name than what's on their identification documents, and a different gender than what's on their identification documents, it's important that we use the appropriate pronouns and appropriate name that they're currently going by. It is offensive to call somebody by a name that they don't identify with at this point. So if someone says, "Hi, my name is Sarah," and on their health insurance card that we might use for billing, it says Joe, we shouldn't be calling them Joe. We should be calling them Sarah. And sometimes that's been a challenge from a medical record standpoint, because we kind of have to bill under their name that's identified with their insurance policy. And there's a place to put gender on there. And a lot of insurance companies and kind of systems that we use for billing are not quite hip to this whole gender not being binary concepts. So it's, from a clinician standpoint, it's important for us to use the correct name. So if they're going by Sarah, we call them Sarah. If they're using pronouns of she, her, hers, we use those pronouns, regardless of what might be in the medical record for billing purposes or, identity documents. So it's important to kind of train all of our staff. So we as counselors may be more sensitive to that, but what about your front desk people? What about your billing people that might have to interface with clients sometimes about bills or about, when they call in? And how do you, in your health record or in your communication systems at your agencies, how do you handle that? And that you're using the correct name that they're going by now, which may be completely different than what's on their identity documents or what's on their insurance documents, which can be tricky. So it's important to kind of think through the policies and the procedures of your organization so that you can be sensitive and, not be offensive to somebody, because when we offend our clients, they tend to not want to come back to us, and they tend to not want to engage in our treatment programs. So, or they're just not going to be as open and honest because it's a form of discrimination, that we refuse to call them by the name they go by, and we are insisting upon calling them by a name that might be on their ID or their insurance card, but that's not what they go by. So it's been really challenging, particularly for the transgender population, because there's a transition that has occurred that kind of the world hasn't caught up with yet in terms of, and getting some of those documents changed is really difficult. So getting your ID, your gender changed on your ID or with your insurance company, or getting your name changed, it's quite a big process, and it's been challenging for that transgender population in particular to go through. And so it's important for us as clinicians to affirm who they are and meet them where they're at. And that means also calling them by the correct name and using the appropriate pronouns that they identify as the appropriate pronouns. I don't identify them, the client identifies them. And that we avoid language that classifies people in this binary structure. So men do this or women do this. Comments like, I would have never known you were transgender. You look like any other woman out there on the street. Or asking questions about genitalia or transitions that may be inappropriate. It's not commonplace and it's not socially acceptable to ask somebody about their genitalia. So why would you ask a transgender person about their genitalia? So things like that we need to be really sensitive to when we're working with these identities, because it's offensive and it's inappropriate to use some of this language that may not be as inclusive. So avoiding jargony kind of statements, stereotypes, being sensitive to the language of the culture. And sometimes we're not going to know it. So a client might use a term that we're not familiar with, and it's not offensive to ask, like, help me understand what you mean by this term, or I don't know that word. What does that mean? Kind of help me learn. And so when you're open to that learning process and you're open and sensitive to not being offensive, and sometimes we can just accidentally be offensive if we're using a kind of assumptive language, like, well, men typically do this or women typically do this, that we can kind of accidentally be offensive. And so it's really trying to pay more attention to the language that we all use, and that it's more gender inclusive rather than putting people in these categories of genders, and avoiding language that just caters to the binary structure that has changed at this point. Promoting inclusivity in your treatment groups and programs. So the important piece for this is to look at kind of how your treatment program operates and what might be gender exclusive, where you are catering to the binary concept of gender, which would make people that with these kinds of identities that we're talking about today feel excluded or feel that it's keeping, that they're not really a part of it in some way. So part of that may be looking at your policies and procedures around, how you structure, if you're doing a residential program, how you structure living arrangements. So do you have like a female wing and a male wing? And if that's the case, how do you handle people who don't identify as male or female? And what do you do with a transgender person, and what does that look like? So thinking through kind of all the policies and procedures you have, and are they related to gender? If they are, how do we need to handle that so we can be more gender inclusive and not segregate people based on gender? So sometimes it may be very appropriate to have groups that are that are assigned by gender. But then if you only have a male or female group, and those are the only two gender related groups you have, then how do you handle these non-binary, intersex, and transgender persons? So looking at those kinds of things around policies and procedures, or what is happening in your groups and how you manage your treatment program and your services around gender, and taking a look at those things and making sure they're inclusive. Also, the makeup of your groups, you may have to do some kind of training and education with the other clients that come to your treatment program around bullying and derogatory language or discriminatory language and behavior, and how you handle that in your treatment programs, not just from the clinical perspective in terms of when you're actively doing services like groups or individual counseling, but also like if you have a residential type program or an inpatient program, how do you manage the community, and how you manage bullying and discrimination amongst the community just living in that space. So again, looking at the policies and procedures, looking at the structure of your treatment program, and is it being inclusive or exclusive? Incorporating sex and body positivity can be really helpful in treatment programs where you're discussing sexuality, discussing expression, making it kind of normal parts of the conversation and of the treatment program, so that again, you're being inclusive and you're demonstrating and modeling for the clients that it's okay to talk about these things, and these things are important in your recovery process. And there may be some trauma related to sexuality and gender that may have occurred, and we need to be treating that in an integrated manner along with the addiction related issues. So I mentioned before, talking about intake forms. So when you get a new client in your program, do you allow the clients to self-identify their gender and to list their preferred name and pronouns? So that may require kind of a change to your intake documents where, and I've seen some programs use like the name you might have a spot for name that's on your ID and name or preferred name. So that again, at least gives the distinction between what might be on their driver's license or insurance card that might be different from what they go by at this point in time. So again, allowing a client to self-identify those things rather than just calling them what their name is on their ID and assuming that that's what they want to be called or what their name is now. And then again, allowing them to self-identify their gender. So if you only have check boxes on your intake documents for male and female, then that's not really being inclusive of people who might be transgender, non-binary, or intersex. So you could list all of those things, or you could just say gender, space, and let people self-identify. So sometimes these things can be a little bit of a simple shift. You don't have to list all the possible genders that are out there because there's a lot, and instead allow somebody to self-identify. And then if you don't know what that word means, whatever they listed, you can always ask and say, tell me what it means to you to be non-binary, if that's the term they used, for example. And then again, pronouns, asking for pronouns. And we're going to talk about pronouns more in just a second. You might take a look at your marketing materials, the posters and things, art that you have up, or quotes or things like that you might have up in your office space or in your treatment rooms, whether it's group counseling, individual counseling, or just kind of in your waiting room. You might promote and post health education materials and signage that feature people of diverse gender expressions. So not just these binary structures of incredibly feminine or incredibly masculine males and females being on your marketing materials or on your posters and things, but including people that might look more gender neutral or more kind of androgynous in their look, or in their expression, so that people feel welcome, that it's okay that this is a safe space for me when a new client walks in. And then access to gender neutral or single stall bathrooms. So this is a piece that has come under a lot of scrutiny in public spaces of, in the past few years around being inclusive of bathroom usage. So in your facility, do you just have men and women's bathrooms? And if so, then what happens for somebody that doesn't identify as male or female, or man or woman? And how are you inclusive, and how do they kind of feel comfortable and knowing which bathroom to go to or what might be appropriate? So you may have just gender neutral bathrooms and not identify as male or female. You may have single stalls or single bathrooms that people can use. So it doesn't really matter what gender you are. It's just one toilet in the bathroom, and they can lock the door. So thinking through some of these processes that may not be intuitive if you're a cisgender person, but for somebody who doesn't identify as male or female or is transgender, then that may be create a lot of anxiety and stress for them, and may be difficult for them to feel comfortable and confident that this is a safe place for them, which then is going to have repercussions in their recovery. They're not going to be as open to the recovery process, and they're not going to be as open to the counseling work that could really benefit them, that you can do with them. And then the training of all your staff, like I mentioned, your billers, your front desk people, who answers the phone, what about techs, or like if you have psych techs or physicians, or making sure that all of your staff are really trained on how you want to handle communication, and that they understand using appropriate pronouns, and where they can find in the medical record the pronouns that any given client prefers. So again, it's kind of creating some additional pieces for us from a systemic standpoint in how we run our agencies and how we run our treatment programs, to think through all these things, and how are we being exclusive and perhaps discriminating against people with these kinds of gender identities versus being inclusive. And then the bottom piece here, sexual wellness integration, and including relationships around sexual health, intimacy, pleasure, satisfaction, because these are all can be components, particularly for people who are transitioning in the transgender population, and for intersex, because they may have some challenges there. They've had medical procedures, things like that can really impact sexuality and performance sexually. So including those pieces in your treatment program can be really helpful. And lastly, talking about pronouns is making sure you're using the proper pronouns. And these are just some examples of what you might hear or see. We know the he, him, or she, her, but they, them, that it's okay to use this referring to a single person. We've traditionally used it in the plural, Z or XE, or they just prefer you use their name rather than a pronoun. So some people who are non-binary don't want a particular pronoun, but just use my name. And then kind of lastly, with our last minute, I'll run through this really quickly, but when you're working with anybody who's non-binary, affirming care, you don't have to understand what it means for someone to be non-binary in order to respect them. So just being respectful of all people. Use the name a person asks you to use. Try not to make assumptions about people's gender, and ask them instead. If you're not sure what pronouns to use, ask them. Advocate for non-binary friendly policies at your organization. Understand that for many non-binary people, figuring out what bathroom to use can be really challenging. So providing that as part of your intake can be helpful. And then, we know this as counselors, talk to people to learn about who they are. And then for the transgender population, I mentioned this earlier, but just to be a little more explicit about it, be careful and considerate about what questions you ask, like the topics of medical transition, sexual activity, their life pre-transition. You might be curious about all of those things, but it's not necessarily appropriate just to ask. Now, of course, if a client brings it up and wants to talk about those things, then that's absolutely appropriate. So things to ask yourself, 2 questions really. Do I need to know this information to treat them respectfully? So basically figuring out, am I just curious, or do I really need to know this information? And would I be comfortable if this question was turned around and asked of me? So if someone asked me about my genitalia, would I be comfortable with that? And then specific topics that transgender people may be uncomfortable discussing, and they may get to the point of being comfortable discussing it with us as counselors, but their birth name, it's not their real name. So avoiding language like that. Their name is the name that they're going by now. So it's using terms like, oh, what's your real name is not appropriate. Asking about what hormones they're taking or not taking, what surgeries they've had or not, questions related to sexual relationships. So all of those things are really sensitive and personal, and we probably wouldn't like those asked of ourselves. So maybe it's not appropriate to ask of our clients that are in the transgender population. So that's all I have for you today. Here's my contact info. I don't see any questions in the chat. So we're going to go ahead and end there. And just a housekeeping thing, you will receive an email shortly, and it'll have a little test to make sure you're paying attention. And that's the way you will also be able to get your certificate. So pay attention to your inbox, that there will be a link coming for you to fill out this little test and evaluation, and then you'll get your certificate. Let's see. Oh, there is one question which I'll address really quickly. Do you think having a separate place for non-binary trans, having them feel not a part of or still feel different, and would asking them where they would be more comfortable staying or what group would be okay, do you think that may be offensive? So yeah, these are kind of tricky things because it really depends upon how your program operates and what your physical structure is. So if you have independent stalls that everybody can use, so if you have kind of the bathrooms that are just one stall bathrooms, that's great, because then it doesn't really matter what gender you are. Anybody, you just might change the signage that says gender neutral bathroom or something like that, or just bathroom. But you know, having a separate place for just this population to use, so again, that's separating them out as if they're different and not included in the general population. That can also be kind of discriminatory or challenging. So, you know, you really have to kind of tread carefully with some of those things and feel out your clients, but, you know, and kind of look at your policies and procedures around those pieces to figure out what might be the best approach in your facility with your unique situation, what might be appropriate. And asking them where they would be more comfortable, that I think that would be a nice way of, you know, gauging someone's comfort level. So if you have a residential program and you're asking someone how they identify, then you could just make it standard practice that you ask everybody, do you feel comfortable being in this room with these people? And if they don't, then, you know, you might have other options for them. But I wouldn't just ask your transgender people. I would make it commonplace that you ask every client what their comfort level is. So again, it's that idea of not making someone feel different because they identify as transgender or intersex, but that's just commonplace. You ask all of your clients their, you know, gender and then their comfort level with being in this particular situation or this particular group or this particular room if you have a residential program, just so it's a thing you ask everybody. And then, yeah, some of you have talked about like the titles of Mr. So-and-so, Mrs. So-and-so, or Miss So-and-so, ma'am, sir. Yeah, all of that is gender language that is not inclusive language. So things like that, kind of trying to adjust our language, can be really powerful and important for making clients feel comfortable. So again, thank you all. I know we've gone over a few minutes. Thank you all for sticking around and for being here. I hope this was helpful. And please be on the lookout for that email so you can get your certificate. So have a great day. Thank you so much.